statement are not typically true in case of hypokalemia. That means which is not true in hypokalemia, that means false regarding the hypokalemia. The option, it may occur as a result of mechanical bowel preparation. Chronic vomiting may increase renal potassium losses. It may associate it with aciduria. It may cause hyponatremia. It often accompanies acidosis. So first of all, the potassium depletion occurs either GIT loss or kidney loss. So the potassium, it can be lost either by the intestine or by the kidney. So any of the route, this potassium may be lost. Chronic vomiting, it is itself less prone to induce potassium loss. Vomiting produces metabolic alkalosis. So in vomiting there is acid loss. So it is easily thought that it is metabolic alkalosis. It is true, but mechanism is something different. Renal potassium wasting may occur as potassium is excreted preference to hydrogen ion. What occurs when there is less hydrogen? Body wants to preserve hydrogen because body wants to maintain its normal pH. In this condition, the body sacrifices potassium in exchange of hydrogen ion. It converse may occur in potassium depletion resulting in acid urine. That means when required, then potassium also reabsorbed. Then hypokalemia, potassium and hydrogen can be true as a competitor. That means hydrogen and potassium, they are like enemy. When there is more potassium, there is less hydrogen ion, and when there is less hydrogen, there is more potassium. And hyperkalemia tends to acidosis, usually associated with acidosis. So hyperkalemia associated with usually acidosis, and hypokalemia usually associated with the alkalosis. Some different or peculiarity may be present, but it is the usual rules. Vomiting, diuretics, they also can cause the hypokalemia. Cushing syndrome, Cone syndrome, they also cause the hypokalemia. Then the diarrhea, renal tubular acidosis, acetazolamide, partially treated diabetic ketoacidosis, they are also responsible for the hypokalemia. Now the metabolic effect of the vomiting, that means when there is chronic vomiting, what occurs? First of all, there is the hypochloremic metabolic alkalosis. As in the vomits, there is loss of the hydrogen ion. With the time, patient become more hyponatremic because the volume is decreasing. For this condition, what body does? Because of the dehydration, sodium is retained and potassium and hydrogen ion are excreted. So potassium and hydrogen, they are excreted by the renal tubule because the renal tubule wants to preserve the sodium. In this result in the urine become paradoxical acidic, at the same time hypokalemia, because there is loss of the hydrogen ion and there is loss of the potassium ion also in exchange of sodium ion. Alkalosis leads to lowering the circulatory ionizing calcium and may also development of the tetany. So in case of hypokalemia, there is a chance of development of the tetany. So which is not true, that means which is false regarding the hypokalemia. It often accompanies acidosis. This is not true because hypokalemia usually associated with the alkalosis. Other cause, it may cause hyponatremia. It may cause hyponatremia sometime. It may be associated with aciduria. It is also true. It causes paradoxical aciduria. Chronic vomiting may increase potassium loss. It's true. Potassium and hydrogen loss. It may occur as a result of mechanical bowel preparation. It may occur mechanical bowel preparation. It is also true. So only false option is it accompanies acidosis.